Voters put health care at the top of their list of issues in the election year Utah Priorities Project. Utah Foundation addressed those concerns about health care costs in a series of reports. Healthcare spending is a growing part of our economy. In 2014, individuals, insurance companies, and the state and federal governments spent nearly $19 billion on healthcare services in Utah. That amounted to about 15% of the state's gross domestic product. Yet Utah spent the second least per capita in the U.S. on hospitals and the least per capita on physician and clinical services, two categories of care that together account for nearly two-thirds of Utah's total health expenditures. While $19 billion is a big number overall, Utah spends the least per capita on health care than any other state in the U.S. Utah's low spending can be explained in part by Utah's young population and healthy behaviors, among other low-cost indicators, such as relatively lower Medicare and Medicaid enrollments. In addition, Utah hospitals appear to be doing a good job keeping costs down. At the same time, however, Utah has had one of the nation's highest average annual growth rates for total healthcare expenditures since 1991, which can be explained in part by Utah's rapid population growth. Utah's growth averaged almost 9%. Increases in healthcare spending can also be explained by the high cost of new medical devices and pharmaceuticals, overtreatment, consolidation among healthcare providers, and increasing administrative complexity. Perhaps surprisingly, the prices charged for medical care can vary substantially within a single market, depending on which hospital provides the service. Utah is not immune to these variations. In fact, the pricing variation among hospitals in Utah can be remarkable, in some cases by over 4 times. This variation among prices charged can be significant for Utahns, depending on the extent of their health insurance coverage. About 61% of Utahns purchase health insurance through employers. This is the highest rate in the nation and significantly higher than the U.S. average of 49%. 8% get their insurance from the individual market, 22% from the government, and 9% of the population is uninsured. While health insurance premiums have increased over the past decade by about 30%, the increases are slower than in earlier decades, when premium increases sometimes amounted to double digits. Over the past 10 years, it has increased about 5% per year. The recent stabilization of premium increases is in part explained by increases in deductibles, which went up by 87% for an individual and 47% for a family from 2006 to 2016. While many may be able to afford the monthly payment, the costs that accompany using the plan benefits may push health care costs for families into the unaffordable range. Another aspect of health care spending is the cost of Medicaid. In Utah, children make up the majority of Medicaid enrollees at nearly 63%. Children comprise most of the Medicaid population and yet account for less than a third of total spending. And although individuals with disabilities account for 15% of the Medicaid population, they account for nearly half of all Medicaid spending. The cost and scope of Medicaid in Utah will likely be at the forefront of Utah health policy for the remainder of 2018 and perhaps years to come. In the background is the ongoing tension between concerns about fiscal sustainability and a desire to bring health coverage to a broader population of Utahns. Learn more by reading the Utah Health Cost Series at utahfoundation.org.